Growing up, I was told no matter what job you get, make sure it has good health insurance. Somebody probably told you the same thing. They weren't wrong in saying it, they were just handing down what they already knew. That's something that my generation and the ones before have lived with. Insurance is a safety net, insurance is required. You can't be healthy without insurance. In this video, I'm going to talk about this and get real. It's fear based. Fear's real. I'm not going to say it's not. The unknown is scary. I'm just going to name that. One thing, though, that's happening is corporations are using fear to condition people to making decisions based on that fear. I've done some other videos around this topic, and this particular video is coming from my heart because when I was young, that was what I was told. Make sure you have good health insurance. Make sure you have good health insurance for your family. Make sure that your kids have good health insurance. It was just a mantra that was given to us, and no one ever questioned it. I never questioned it until I got older. And in my 30s, I was diagnosed with PCOS. And having PCOS is a metabolic issue, it's an internal issue with my body. And I was just given a prescription and said, here, go take this. Nothing was ever talked about of how I could change what I was eating, how much I could change with movement, what would actually happen if I was eating the proper foods and managing my metabolic health properly. None of that was talked about. And this was in the 90s, the late 90s. So here we are in 2026, and I love seeing this. People in America are questioning what is going on with insurance. My health insurance is not helping me be healthy. It's for sick care. Health insurance covers sick care. Even if they say it's preventative and just pay your copay and go see the doctor once a year and you'll be taken care of. That is not true. And I'm honestly saying that from my own experience. Maybe it's true for some people, but let me ask you, the last time you went to the doctor, did they spend time with you to really drill down and find out what was wrong and what was causing your symptoms? Or did they just ask, how's your prescription going? How are you feeling? And should we change it? That's what I get every time I go to the doctor. And I'm in my 50s. So I'm at a time in my life where all the things that I did when I was younger is adding up and it's happening internally in my metabolic health. And I'm going to tell you, there are millions of Americans out here that are suffering the same way. Functional medicine looks at root cause. We have energy practitioners, energy healers that look at the overall energy well-being of us. So there's all of these things that are being discovered, but the healthcare system isn't getting on board. And it's because it's run for sick care. It's run to give you a pill, give you a prescription, give you something to make your symptoms go away, but it doesn't actually heal you and make you healthy. So, how many times have you gone and put in the comments anything that you've experienced? I would love to hear from you what your experience is with the traditional healthcare system. When you go to the doctor, do they actually ask you, "Hey, how can we actually get you better?" When did the doctor ever say to you, "Let's figure out how we can make you better?" Not, "Let me see what prescription I should give you for the symptoms that you've come in for." I've never had an experience like that in my 53 years of life on this planet. I have never had a doctor that said, let's figure out how we can get you well. They've all looked at a chart, looked at my labs, and looked at a prescription list. Let's try this. Tell me how you feel. Now let's try this. Tell me how you feel. None of it was around how I could actually get better. That's my experience. So that's why I'm bringing this up, because now I'm actually working with practitioners that look at overall health, well-being. What is your lifestyle doing? What are you eating? What are you eating and what is your environment like and how much movement are you getting? Are you getting enough sleep? All these things work together. And we're just now learning how powerful these things are. And it's shining a light on the sick care system, our healthcare system, that spends 15 minutes with you and doesn't even ask you about some of these things. And you're just getting a pill or a prescription. We really need to look at ourselves and take responsibility for our own healthcare. A health insurance company is not going to take care of you the way that you would take care of you. I'm taking care of myself better than my insurance ever could. So, this is where taking back responsibility means okay, I'm going to evaluate how much I'm spending on health insurance. Really look at that. How much money are you spending every month on having health insurance? And then how much money are you spending on deductibles and copays? And how much wellness care are you getting for that money? Just do the calculation. And when you come up with a dollar figure, then you can evaluate, is it worth it? Again, this is about choices. I'm just naming the elephant in the room, which is we have been conditioned to be scared, to be scared of the what if. What if something happens? What if I get a chronic disease? What if there's an accident? And I'm not saying don't prepare for emergencies. That is on us. Yes, we need to prepare for them. There's high deductible plans out there. I just did a video around this talking directly to Pennsylvania because in Pennsylvania, you can go without health insurance. Some states don't allow that. So I'm not highlighting that here, but you can do a high deductible plan, which means it's lower cost every month. You pay less, but you have this massive deductible. So if an emergency happens, you pay that big amount and then they cover the rest. Again, if the insurance company approves it, they can disapprove anything. So again, thinking this through, just take back the responsibility. Don't just throw your money at an insurance company and go, oh, they'll take care of me. Because that's not true. They get to decide what they approve and what they don't, and they may or may not approve what it is that you're sick for. That's on them. But if you look at yourself and go, okay, how can I make myself well, holistically well? Who can I go see? That's where the centered care directory comes in. It's a list of practitioners that are cash based. So they look at the whole body, they look at root cause, like how can we help people live healthier lives? How can how can we help them find what's really going on, treat it and get healthier? So they're not having to take as many prescriptions. And you may have prescriptions that you have to be on and your body is relying on it and you can't get off of them. That's okay. There's other things you can do in your life, though, to improve your overall wellness with the guidance of people who are educated in it. And that's who's in this centered care directory. People who have education around how to take care of our bodies and how to have wellness in all different types of ways, not just the scientific medical way under health insurance. I know it's a lot. And I know for me, it was a big decision to make to take back my own responsibility of my care. My healthcare is my responsibility, not an insurance company responsibility. And so I just saw on the news, we're right around tax time right now as I'm recording this. And it just blew my mind that on the news, they're talking about what to do with your tax refund. So people who are getting a refund, they're like, oh, put money aside for an emergency fund. Use that money as your tax refund and go put it in a high yield, a high interest savings account or something that earns money so that you have a buffer. You have money if something happens. And I just thought it kind of made me chuckle because I'm like, most people don't do that. Why? Some people are paying $10,000 a year, $12,000 a year, 10, 12, $15,000 a year. Some of them upwards of $20 to $30,000 a year to an insurance company. And they're not even getting the care. They're they're not that sick. They don't go see the doctor that often, but they're like, "Oh, I need insurance." So the money just goes out the window. And great, if they have the money to burn and they wanna do it that way, sure, you can do whatever you want. But for those of us who are like, every little bit of money that we have is important and we want to be intentional about how we're spending it, that's taking responsibility financially as well and saying, I'm going to put that money in a savings account. And if something happens, I have some money set aside to help get through that trouble. Or I'm going to spend it on a high deductible health insurance plan that will cover excessive, like hundreds of thousands of dollars in medical bills if something were to happen. Options. Thinking through these options, taking back responsibility, and not just going with fear and what's been conditioned. That's what this is all about. So, the Centered Care Directory, you can click on it in the notes below. If any of this is resonating with you, comment below what your experience has been. If you agree, disagree, just getting a dialogue going, I think, is powerful to get people thinking outside of the fear, outside of the what if, outside of the I need insurance, I can't live without it. Thinking through that and having a dialogue around it, I think, is really important. So comment below, let me know what's happening for you or what you want to share, questions you have. The other thing is, if this is resonating with you, subscribe to this channel. Click the subscribe. I'm going to be sharing more information. I'm also going to be sharing educational information around numbers of like what it costs to have cash based care versus insurance and what are some other choices. It's about options. I am not anti anything. I just want people to step back and think for themselves and do what's best for them. What is best for you with when it comes to your healthcare and your finances? You get to decide. So options are big. I'm going to be sharing more on this channel. And again, if you're looking for a cash-based practitioner, click on the link down in the bottom of this video, and it has the Centered Care Directory, which is where you can search by state, specialty, and find what it is that you're looking for to help you on this wellness journey. We're here to thrive and enjoy life, not just take care of our sicknesses that come up. That's something we need to do. When we get sick, we need to get help, but it shouldn't be a daily occurrence. It shouldn't be happening chronically. We have these amazing bodies that can heal themselves if they have the right support. So click on the link, check out the directory, get the right support that you need. I'm doing that, and it's been absolutely amazing. Less than a year, in less than a year, I think it's been about 9 months, I have been implementing what I'm learning about my own condition, which again, I was diagnosed with PCOS, thyroid issues, and other things that have to do with metabolic health. The more I learn and the more I understand about how I react to certain foods, when I eat, how much I eat, all those things are making a difference in my physical body. I'm feeling better than I ever have. And that's amazing. So, check it out, check out the directory, and if you're curious, just ask questions. There's nothing wrong with just having curiosity, asking questions, finding out what works for you. We all have options. So in the next video that I do, I'm going to be talking more about numbers and balancing between cash-based and insurance-based healthcare, how that looks financially so that you have some numbers behind it. So check out that video when it comes out, and you'll probably see another video pop up here that is in this channel. So check that out as well. See you next time.